Hey, welcome everyone to our COVID Mental Health Forum. Today's topic is going to be global perspectives on intimate partner violence and safety in the home during the COVID-19 pandemic. And before we jump in, I just wanted to remind everyone that these are recorded, and the recordings are posted on our website, and again can be viewed later or shared, as well as we also post the any resources or slides that are shared by our participants. And just a few notes on Zoom logistics, although many people are now familiar with these, having been doing them for the last 3 or 4 months. This will be a panel discussion followed by a moderated question and answer. The best place to put the question and answers is in the Q&A box on Zoom. And that way I will be moderating the questions, so I will pose them to our panelists, and also I can sort of quickly answer them if there's some specific questions. We will be posting web links and things in the chat, so you can look for those there. And you can also email us afterwards, at any point if you miss something, or you forget what we told you, or you missed something in the chat. Just asking that people, I think mute themselves. I think it's just the panelists and stuff that are unmuted. And I think that is it. So we're going to start with 3 sort of presentations. Our 3 speakers will give an overview on what's going on in terms of COVID and partner violence in their respective locations and with their organizations. And then each will do that, and then we'll do the question and answers. So I'm going to give brief bios of our speakers ahead of time, so that they can just, so their presentations can flow into each other. So our first speaker is, well, now I'm going to mispronounce. Can you pronounce your last name for me again, Peg?
Hacskaylo.
Hacskaylo. Okay, I looked at it. I was like, yikes. Okay, Peg Hacskaylo. We're really delighted to have Peg. She's the founder of the National Alliance for Safe Housing, whose mission is to ensure that survivors of domestic and sexual violence have the full range of safe housing options through improved access, increased resources, and innovative solutions, and ultimately catalyzing a safe housing movement. The vision, her vision and the vision of the organization is to create a world where safe housing is a human right shared by everyone. NASH is a subsidiary of the District Alliance for Safe Housing, DASH, a local program in Washington, D.C. that Ms. Hacskaylo.
You can just call me Peg.
They just call you Peg. All right. Yes. That's my first name's hard to pronounce too, so I empathy for there. Ms. Hacskaylo founded in 2006 to provide safe housing and housing access for survivors of domestic and sexual violence facing homelessness. She holds a master's degree in social work from the University of Pennsylvania and a certificate in organizational development from Georgetown University. And also, just to mention, we will put in the chat, we will put the different organizations, DASH and others, are on Twitter. So we will put those in the chat so that people can follow them. So Peg's our first speaker. So Peg, actually, now that I've done it, why don't you go ahead, and then I'll introduce Goody, because then I'm realizing it's going to be weird if I introduce everyone before you speak. So go ahead, Peg.
Right.
Thank you so much.
Happy to thank you all for hosting us and giving us the opportunity to talk with you a little bit about what we're seeing in our respective countries. As Karestan said, my organization focuses primarily on housing for survivors, and so that's really where we have been focused. If you could go to the next slide. I'm going to try and keep this brief because I want to make sure that we have enough time for the Q&A. So Shaylee, if you want to go to the next slide, that would be great. And every time my slides come up, there we go. So as I said, we've really been looking at how COVID has been impacting primarily domestic violence shelter programs in the last few months that are coping with COVID. And one of the things that we found overall is that the pandemic and the response to it is actually exacerbating more and worse domestic violence across communities, but programs have really been limited in their ability to respond as effectively as they'd like to. The demand for shelter and the calls to hotlines have spiked in recent months, some upwards of 50%. We're finding that reports of increased domestic violence during times of economic crisis is usual, but because survivors have to be quarantined with an abuser during this time, we think that survivors have been especially at risk. A lot of communal shelters for victims have to find alternative placements for their residents in order to reduce the likelihood of COVID transmission because they don't have a lot of internal capacity for spreading out their beds or improving social distancing within their facilities. And so while shelter capacity was, before COVID was frequently scarce, now programs are facing added pressure to find other housing for survivors because their existing capacity has been limited. Additionally, placement for survivors in homeless shelters hasn't been an option for the same reason. And in fact, what we've seen is that families in longer-term homeless housing programs are also experiencing increased domestic violence, which is resulting in the need to move survivors out of those programs. But as you can imagine, there is limited space in domestic violence shelters for their safe housing. So it's really proving to be a catch-22. Also, domestic violence shelters are seeking to put survivors in hotels as alternative housing, but again, that may not be an option because a lot of jurisdictions have been using hotels as overflow for either homeless individuals or overflow for hospitals. So that hasn't always been an option. And finally, programs are facing the same things economically that many of us have been facing, including budget cuts, stretched staffing, and the need to just manage the conditions of COVID in their facilities, including conducting deep cleanings, operating in shifts, and often functioning without the necessary PPE. So it has been a real challenge for programs. Next slide, please. So one of the things that we have been doing through NASH and with our partners is conducting an ongoing survey with programs to find out from them directly how COVID has impacted their ability to serve survivors. And one of the first things they've told us is that some of the most urgent unmet needs are around providing new and basic resources to survivors, including food, financial assistance, healthcare, childcare resources. So some of the things that survivors just have to survive, and that many of the programs in response have been shifting to virtual advocacy and enhanced safety planning in the context of the pandemic. So while they haven't been able to serve as many people in their shelters, they've been trying to continue contact with survivors in other ways. They've also found that survivors have been more fearful about seeking help from shelters because of their fears of infection, which are justified. But programs are also experiencing reduced capacity, as I said before, and therefore having to house survivors in other locations. Next slide. They've also told us that they've been impacted, that while they've been impacted by COVID, they've been challenged to identify alternative housing options outside of their shelters, as well as limitations to basic community resources. So because of the economic downturn, food pantries and financial assistance programs have also been closing their doors or reducing their ability to provide services, which naturally has had an impact on survivors. Some programs have mentioned that simply staying in touch with survivors to ensure their safety has been challenging, particularly since there's not enough direct service staffing because of lockdown orders. Despite programs, many staff working more hours to meet the growing need. Next slide, please. And finally, we've also heard from programs that the need to support staff in their programs has been intense. So they've really been focusing particularly around caregiving responsibilities and supporting staff with remote work expectations. Some programs have been providing electronic means for staff to conduct their work, computers or tablets or phones, as well as giving them emergency supply funds so that staff can get what it is that they need to best support survivors. A lot of staff just have limited technology or adequate PPE to conduct on-site work. Next slide, please. So for us, what this all adds up to is, and what we're trying to encourage programs to understand, is that they can still conduct safe housing services with survivors. It's just going to look really different. Programs are coping in the best way they know how, which is primarily about getting back to basics, focusing on safety and housing stability in a way that meets survivors' needs and honors their expertise in their own situations. And what that looks like is providing low barrier access to services so that survivors can get whatever help they need, providing support and advocacy in the community that's separated from shelter. So in order to prevent the need for shelter and anticipate survivors' needs for housing placement. Allowing survivors to choose what services they find most relevant and helpful, conducting safety planning that's comprehensive, including helping survivors plan for dealing with COVID, because their lives are not static, providing flexible financial assistance for survivors to help them maintain safety and housing outside of shelter, ensuring that services are individualized and flexible to best meet survivors' needs, and then finally enabling access to a variety of different housing solutions, not just shelter, but other kinds of housing options for survivors. So I look forward to our conversation about all of this, and we have a bunch of resources if people are interested in following up. Thank you.
You're still on mute.
I'm muted. As was in the title, these are global perspectives on domestic violence during the time of COVID. So next we'll hear from Goody Burnett, who is CEO of Standing Together and has worked in the field of domestic violence for 15 years. She is currently in the UK, and she also co-founded the Domestic Abuse Housing Alliance, which is DAHA in 2014, which is a national initiative to improve the whole housing sector response to domestic abuse. She chairs the National Housing and Domestic Abuse Policy and Practice Group, which has over 20 representatives from across the domestic abuse, housing, and homelessness sector. And she's spoken all over the world, including in the UK, where she resides, but in the US, Canada, Australia, Northern Ireland, and Europe. She's a Winston Churchill Fellow and was shortlisted for Red Magazine's Pioneering Woman of the Year in 2016, and was nominated as one of the Women of the Year of 2018. And we're really delighted to have you, Goody. Thank you so much for doing this.
Thank you for having me. It's a really odd situation when someone's reading out your bio and not to cringe at yourself. I'm sure Peg felt the same, kind of like, oh. But anyway, it's lovely to be here. I know we're again short of time, so I just wanted to give a whistle-stop tour. I'm kind of here wearing two hats. One is the CEO of Standing Together. I've been in that position, it's my 4th month. So in my interview, they definitely didn't ask how I was going to deal with a pandemic. So it's been a very full-on time, but there is some amazing stuff happening and the team have just been incredible. But for a longer time than that, I've been the co-founder of the Domestic Abuse Housing Alliance. But Peg did a wonderful job at explaining a lot of the stuff that's happening in housing, which is similar to the UK. So I'll only pull out some of the things that I think we might be able to add to as I go along. So if we go on to the next slide, please. In terms of standing together, our work is really in how you bring communities together. So the coordinated community response is what we've pioneered for over 20 years in the UK, especially in London, but we've branched out to other areas of the country in terms of our whole housing project, which is in Stockton, which is up north, and Cambridgeshire, and then also in London. And it's this idea that for anyone experiencing domestic abuse, you know, it's not one agency's responsibility. You know, for a long time it was seen this as a police issue, social services, and it just isn't. In terms of bringing communities together to really tackle domestic abuse, that is what Standing Together have pioneered for a long, long time. One of my staff reflected to me, you know, what has COVID meant for us? And I have to say there were already huge gaps in terms of service provision and lack of funding in the UK. And what COVID-19 has done is just made those gaps much wider and much more visible. So we've got a big job in order to try and fill those. So if we go to the next slide, I can explain sort of the areas of work. So we work in health and A&E, we coordinate trusts, we work in mental health trusts, maternity services, housing, which is how I know Peg, and I've had the honour of working alongside her for many years, and she's somebody I admire very much. We have and coordinate MARACs, which are Multi-Agency Risk Assessment Conference, which is quite a unique thing in England. So we have multi-agency meetings on a monthly basis where you bring all partner agencies together, so probation, housing, education, social services, mental health, substance misuse, and essentially people are referred in who are at highest risk of significant harm of death, basically, in every local area. And the idea is you bring all of those organisations to create a joint action plan, because the responsibility shouldn't fall with just one agency. So at Standing Together, we also do specific work in courts. Our community-based work, so we also lead something called the Faith and Violence Against Women and Girls Coalition. So that's how you work with faith communities. So the breadth of Standing Together and what we do is in housing, but also across all of these other areas that I haven't got. I mean, it would take me a whole day to go through that whole thing, but we've only got sort of 10 minutes each. So I just wanted you to have the pictorial representation. And if there's elements of that you're really interested in, you can go on our website and have a look at it, or we can have a general conversation about it, because in every aspect there's some really nuanced and interesting, but also very pioneering things happening in this space. I think as a sector we've really had to innovate very quickly. I think Standing Together, we went from being able to have 5 staff work remotely to 30 staff overnight, and what that meant and how we operate in the current context. We also lead in the on domestic homicide reviews. We chair a number of domestic homicide reviews. So every time someone is murdered as a result of domestic abuse, it's a statutory duty essentially for the local authority or our areas to carry out a review of what happened and lessons learned and what could have been done differently. And we've also led on a number of those across the country in the UK. So that's just a whistle-stop tour of everything that we kind of do at Standing Together. Next slide, please. So I think with COVID, and just to give you the context of this, I think there was this real understanding that where people were accessing support was changed overnight. I think to give you an example of some of the stuff in terms of our housing, so we've got an accreditation process in the UK where we go in and audit housing providers to improve their general response. So they're not specialists, but to make them understand and train them up about how they can recognise and respond to domestic abuse and how they must work with specialist services. And one of the main things was we produced a lot of guidance, which is the best practice guidance, which you'll see as the last bullet point. And what we realised is what housing providers, so our neighbourhood managers, our caretakers, our estate managers, they needed to know how to approach a situation if the perpetrator was in the house at the same time, because that was the biggest concern about someone isolating with a perpetrator. And the team are just phenomenal and came up with some really creative ways of trying to access people safely where all of their other avenues were completely taken away overnight. So they couldn't just go to the local authority, they couldn't go into a local housing office, self-isolating at home with the perpetrator right there. So we identified the roles of neighbours, and the government pushed out a national campaign for You Are Not Alone. We're now got the national helpline number on receipts in Tesco's as standard. So Tesco's is one of our biggest supermarkets in the UK. So trying to think of creative ways to push that information out where people couldn't access it. And there's been, I have to say, a lot of coverage on our national media. The Prime Minister actually even talked about domestic abuse in one of his briefings to the entire nation. So all of a sudden there's a huge spotlight on domestic abuse. Not to say that it wasn't happening before, but that's really made a lot of difference and change. We've had an increased demand on our helplines and our live chat. So that Women's Aid live chat, you can actually get onto it discreetly while you're at home, and they've seen a massive uplift. Again, Peg's talked about mobile advocacy, but again, just the level of complexity and the resource that is required. Whereas before you'd have like the ability to do, I don't know, like a housing benefit or claim, or, you know, a claim to some sort of welfare benefit or anything. That's all been what would take you an hour takes you 3. So all of that, and then you've got a depleted workforce as well. So it was kind of how do we respond, and how do we make sure that we're getting it right for people? And as a result of that, standing together, because we work in the courts, we work in health settings, we work in housing, we work with domestic homicide reviews, and obviously, and the MARACs, we were able, I was really proud of the team, they pushed out a lot of best practice guidance that then was adopted nationally in those first couple of months. So please take a read of them, because I think there's crossover across all sectors in terms of how you can access people and how you can support people in the context of them being totally isolated. So next slide. These are just a couple of examples of best practice. I think Peg mentioned about the hotels being used, but the Mayor's Office, 1.5 million in terms of, I think it's 82 bed spaces. And what was interesting about that is that some of those spaces were for women with no recourse to public funds as well. So that's where they can't access benefits and they're not entitled. And again, now the huge conversation, and this is a whole other half an hour conversation, is move on. It's really demonstrated to us that we've got a huge issue in the UK in terms of moving people on from refuge or emergency accommodation. And to be honest, for me, that's a welcome conversation to be having about how you know, people shouldn't be in refuges longer than they have to be. You know, we need to free up the space for the family that then needs that right now. So that sparked a whole debate. Housing first and multiple disadvantage. So we just got some funding to increase space in London in terms of homeless women with multiple disadvantages. I'm talking about alcohol, substance misuse, and it's about having a property, a unit there, and then you wrap the support around. Housing First has been shown to be very effective across the globe, but it wasn't first created with the framing it around women's experiences of homelessness. And actually on my fellowship, I actually went to visit Peg in the US and learned a lot from the US to actually bring it to England. So I'm just giving you that link as well. And then also we've just done this huge national campaign, and we've had support from our new Domestic Abuse Commissioner, who's fairly new into post, but also is a co-founder of DAHA, the Domestic Abuse Housing Alliance, and was the previous CEO of Standing Together, where I'm at now. And it's about trying to link refuges to housing providers so that they're proactively direct letting to people coming out, and all the information is there. So that's only 3, but I have to say, where this has been really, really hard in terms of the uplift and all of, you know, just the trauma and knowing what people are going through is just so harrowing. But in terms of some of the initiatives that have been created to respond to it, it has been amazing to watch as well. And people are starting to really understand, well, raise awareness. So I use the example of, like, you know, a friend of mine, you know, talking about her friends are all of a sudden talking about this in a very different way, whereas normally it was only me ever talking about it. So that to me feels quite hopeful. And I think that is it. Yeah, there you go. So that's me, that's Standing Together, that's DAHA. There's a lot more, but obviously I just want to get onto the Q&A and hand over to Lily. Thanks.
Great. Thank you so much, Goody. And so in the last speaker for this beginning part will be Lily K. Ross. And I want to thank Lily for, first of all, she's in New Zealand. So you can just, the audience can figure out what time of day it is for her that she's doing this. And also she connected us with Goody and Peg. So she really helped bring this whole thing together. And this is a topic I've been wanting to do on a forum for months, and just wanted the right people. So people really doing the work in the field, and really sort of in the trenches. So Lily K. Ross holds a Master in Divinity from Harvard and a PhD in Gender Studies from the University of Otago. She has consulted universities in best practices in sexual violence prevention and response, and served as an expert consultant on sexual misconduct policy and procedures. She continues to research due process and recourse for reporting and responding to sexual misconduct, and co-founded a startup working to end workplace sexual harassment. Lily has developed curriculum in collaboration with the New Zealand Defence Force and facilitated the Flip the Script program, which is a gold standard in evidence-based feminist women's sexual violence resistance education. So Lily, excited to hear from you, and then we'll have some questions and answers. And meanwhile, people can put Q&As in the box. We have some questions, and if you have things for specific speakers, feel free to indicate that so I can read them to them. Thank you.
Thanks so much for having me, Karestan. So a bit of a caveat, which is that my background is usually in sexual violence related work. And I ended up, when COVID-19 hit, getting involved in various aspects of the response here in New Zealand, where I live. I'm from the US originally. And so to prepare for this presentation, I actually talked with people from a number of organizations across New Zealand. So SHINE, which is a domestic violence organization on the North Island, Maori Women's Refuge, and OCASA, and the Defense Force, and Toa Nest, and the Ministry of Justice. So I cast a wide net, and I tried to get sort of input from both the sexual and family violence sectors to inform what I was going to share with everybody today. So just a little bit about New Zealand and our response. We have a nation of about 5 million. And so our needs and our ability to collaborate nationwide is a bit of a different situation than a lot of other countries at the moment, especially the US and the UK. And we have 4 alert levels. And so I might reference those at different points. I wanted to just explain very briefly that level 4 was our most intense lockdown. We were in that for 5 weeks. And at this point, we have very, very few cases. So once it was announced that we had 4 levels, then 2 days later, they said, well, we're going from level 2 to level 4 in 2 days. And that was a point where people really started trying to get prepared for that. And within our sector, there was a real scramble for people to start talking to each other and making new plans, because it was such a fast moving situation. So we had, in general, quite a strong national response to coronavirus. Borders were shut down quite quickly, and because we're an island nation, it was easier to sort of do that. And there was frequent briefings from the Prime Minister on television, but there were some in the first days, the family and sexual violence sector wasn't so much at the table. And then we kind of got ourselves to the table. So there ended up being a sexual violence and family violence working group that had nonprofits in both of those spaces that were then in conversations with government agencies and representatives to try and come up with a more comprehensive plan for how we were going to respond to COVID-19. And it's actually led to greater planning for like the post-COVID context in terms of where are we going moving forward, and it fast-tracked. We've gotten like $200 million into our sector since that was announced in the middle of lockdown. And so part of the response here was also informed by the Christchurch earthquakes. And so people anticipated that we would have very little reaching out for reporting in those, to report things or to seek help in those early stages and at the higher levels of lockdown. And that's what we've seen. So the people who were requesting help during lockdown, there was an increase in severity of abuse, but perhaps not frequency from what it looks like in the early data. The help seeking was, there were a lot of self-referrals from perpetrators, actually, and high-risk victims. And so, yeah, things kind of went quiet, and those were the people that were coming through the door. It was difficult to leave home during level 4. So, and this was one of the big missed opportunities for comms. Some people might have heard about the bubbles, the language of the bubble in New Zealand, which had to do with the group that you were isolated with. But there wasn't enough communication from the top early on of like, if your bubble is not safe, it's okay to leave your bubble. So there was some frustration within our sector that we didn't get that level of communication when there was so much at stake. So the one of the other interesting findings was like people that were in counseling already or seeking help already, sort of some of them dropped off, which was anticipated, but a bit difficult. It became very hard to reach some people. So the big thing that I want to talk about actually are well, really it's the money, because the government's response was very much a like, let's throw money at the problem, in a way that was really welcomed by the various people across different agencies that I spoke to. And a lot of them described it as high trust funding arrangements. And so there was flexible funding that was given to agencies that have been working on the front lines for decades, who knew what to do with that money and who are really good at making that money really stretch quite a long way. But they're kind of low accountability funding as well. So the government had passed along large lump sums that were easy to apply for, and there's not really any follow-up in terms of having to heavily account for where everything went, although a lot of the agencies have said they're doing that anyway, for their own records as much as to report back to government. So that's made a really big difference, and a few of the agencies that I spoke to made points about how women's needs at this time are obviously around shelter and safety, but also a lot of needs around dignity. And so there's been funding available for buying clothes if women are being extracted from the home, or providing people with cell phones if they didn't have that before. I think it was Spark New Zealand, which is a phone company, donated like 700 phones. And so there's been ongoing discussion about getting communications available in the home that weren't available before. A few things that people noticed that were quite interesting in this space was that the hospitals were less crowded on lockdown, so they could actually provide more focused help to victims. And then the ISR, which is the Integrated Safety Response, is a policing program that's been rolled out in Hamilton and Christchurch. And that program is designed to upskill cops in terms of responding to family and domestic violence. And so because of lockdown, there was a lot less other crime. And so the police actually became more helpful in those areas in particular, in being able to respond, catch perpetrators. It was a game changer in stopping violence and holding perpetrators to account. So it stopped the behavior. There was an increase in victim statements, and they were able to remove perpetrators until the end of lockdown from a number of situations instead of having to relocate victims, which turned out to be quite interesting. There were other places that don't have the same ISR policing training that said the police have been just as useless and problematic as they've ever been in this space. But the places that had that response seemed to be more pleased with the overall police response on that front, which is, I think, particularly interesting in the context of the what's happening with Black Lives Matter in the US, and there's questions being raised about what's the role of police and where can they help, and seeing how in a crisis like this, it's very clear that there are certain types of education and training that maybe could be served even by people that aren't police necessarily, but that, you know, when there's that focused, concerted attention on this issue, that progress or good things can actually happen, or good interventions, I should say. There were some self-referring men, which I mentioned earlier, and there was the funding available to get them into programs. And so this was a bit of a game changer as well, because oftentimes when men present wanting to seek help and stop violent behavior, they don't have the resources available to put them into a program based on self-referral. Often they have to get referred to the programs by courts, so they've already acted violently, so it's a bit backwards in that sense. Some of the other things that were interesting that I was hearing from people was that there were more people at home who became aware of the dynamics at play in the home. And so there were more family and neighbors that were seeking out support if they were overhearing or witnessing violence in different ways. And yeah, that violence did tend to be to escalate in severity. There was really amazing work being held up as well, particularly at Maori Women's Refuge. They talked about family and whānau resilience, and that's a word I might use occasionally. Whānau, it's a Maori word that speaks to like a wider community or extended family. And so there were more calls to police from neighbors and more engagement. I mean, in some instances, you had a lot of family coming home who maybe had been away, and then suddenly, people are getting a sense of what's going on. And there was some really clear indications from people I talked to that they were pretty impressed, wildly impressed in some cases, with how families stepped up to manage their own safety in the crisis. Which I think is really important to bear in mind, just that, our survivors are the experts of their own situations, and that there are models for family resilience and people really showing up when it matters. A few other things I'll note about the general New Zealand response and the sexual and family and domestic violence. So here there was an increased access to welfare benefits, and there's been, those benefits have often been through employers. So they subsidized employers to pay their employees. One of the things that did was maintain employee-employer relationships rather than cutting people loose and then hiring them back on, or different arrangements like that. And so people were able to continue working, which for some may have mitigated some of the financial stressors, but also given them points of contact with people outside the home. In terms of the housing needs, so there were congregate shelters that were shut down, or like they would stop running programs, and then they would keep a few people within the shelter, but those people were primarily people who it was a reduced capacity, and then they moved other people into motels, and there was a lot of funding and support to do that. So there was this Safe Night app where people could kind of donate. There was that increase in government funding, so there was the resources to do it. So they put people into motels pretty commonly, and at first it was a bit of a it was a bit clunky, because they soon figured out that there were perpetrators and there were victims and there were homeless folks. And there were people in various kinds of mental health crises or addiction-related crises who were all getting moved into the same motel, and that had to be remedied quite quickly. And the people that were working in those motels had to get upskilled quite quickly in terms of some of the basics of managing this kind of a situation on their site. There were questions for staff around face-to-face contact, so like if and when to actually go out into communities. And Maori Women's Refuge in particular talked about having more license in some ways to actually go out and have those conversations and get involved in ways that they felt were actually better than pre-COVID. So that was really interesting as well. One of the last points I'll make before closing this little presentation is just the staff needs have been a bit different. So like staff are working from home. There's been a lot of upskilling of people across the sector. Various things have moved online, and filing systems that were offline for decades have been kind of rapidly moved into secure online platforms, which has been really helpful. But there's been gift baskets or extra funding because it costs more to be at home when you're at home all day, or I heard a lot about managers that had just made themselves very, very available to support their staff. the staff have been working really hard. And I think that's one of the things that has like also been a resounding message, both in the conversations I had to prepare for this chat that we're having today, and also in the many, many conversations over Zoom that were happening beforehand, is that, yeah, people are, really, really keen to work together, really keen to find solutions together. And the management has been really on point in terms of trying to be extra available to support staff, because it's difficult, obviously, being at the front lines in this kind of work. So I will close that there for now and hand it back to Karestan. Thank you.
Great. Thank you so much, Lily. And thanks all of you. So we already have questions. I have questions, but we have questions coming in for everyone. And so just to start, and maybe we'll start with Peg and then Goody, because Lily talked about this a bit. One of the questions was for all of you: what do you think the sustained impact of COVID-19 on the way that IPV services are coordinated, financed, and delivered? I know you each talked about some of the kind of challenges and impact, but do you think there'll be some sustained changes, or do you hope there'll be some sustained changes? Why don't you start, Peg, and then there's Goody.
I do hope there will be sustained changes. I think what we've heard from programs is that they, in the process of making this shift from all of their services and everything sort of being in the basket of shelter and programs that are delivered out of shelter, to being able to provide services effectively to survivors in their communities or where they are without their having to be in shelter. That's been a tough adaptation for a lot of programs, but I think in the process they've realized that many survivors like it more. This is all, of course, contingent on the idea that it is safe for survivors to remain in the community, right? There are always going to be those who have to have a confidential refuge that they can run to and hide from someone who is an active threat to their lives. But for a lot of survivors, that's not the case, that they actually can be facilitated to live safely and stably in their own communities or in a different community. And I think programs have recognized that they can successfully make that shift. So I do anticipate that there's going to be some endurance of that. And I also think that funders are going to start expecting to see that more.
What about you, Goody? That's really interesting. I actually wasn't aware of that at all. But do you see similar things in the UK or other things?
Yeah, I mean, I was, when Lee was talking about people throwing funding or like all of a sudden there being an injection of cash, I think the thing that we've seen is some of it is very short term, so the longer term is actually quite frightening. I also think that we don't have all the answers. Like for me, running a charity right now is that every week is different and it shifts, and I think governments and people need to understand that and get to grips with that, because what they do right now might not be the best thing in 2 months, and it's good to have the flexibility to do a U-turn or change it depending on what actually we know survivors want. That's my biggest hope, that we can have that kind of flexibility, so we're actually really truly responding to survivors and children and what they need right now. I think the other thing that feels really hopeful to me is that it's blown the conversation open wide in terms of like, what does a good response look like? You know, we've got refuges and shelters, but refuges and shelters aren't for everybody. So what are the other things that we could be innovating, thinking about? You know, how do we access people in health settings? How do we make like communities more aware of this? What do we do with perpetrators? So there's a call to action in the UK at the moment about a perpetrator strategy, and we've also got the domestic abuse bill coming through. So I feel like there's this wider kind of acknowledgement that we need to be doing much more than just focusing on like one option, and it should be just like so many people. So yeah, and in terms of long-term sustainable funding, that's always a hope of ours, right? I feel like there's more attention on this, so that could be a hope. But again, to really innovate and really change, that needs to be, we've got a real problem here that we just have like 1 year or 2 year contracts, and that's not enough to do something, evaluate it, get the survivor's voice about what the impact was and how that worked. So still a lot to do, put it that way.
And if I could, I know, Lily, I know you have a lot to say about this, but if I could also just say one more thing, and that is that we recognize, at least here in the United States, that a lot of communities of color and culturally specific communities haven't had access to the same kinds of mainstream programs and resources that you know, have otherwise been available. And so a lot of the strategies that we've been promoting and that we've been seeing programs move to in terms of mobile advocacy, flexible funding, comprehensive safety planning, are the kinds of services that these marginalized communities have had to employ for decades anyways. And in a lot of ways, survivors of color prefer that, because they don't, not just survivors of color, but you know, there are many survivors who don't want to have to engage with mainstream systems. And so in a lot of ways, what we're lifting up are practices that have been in existence for years.
Yeah, so
Really?
piggybacking on a few things that have been said. So one of the outcomes here that's been surprising and exciting is it sort of did advance the $200 million budget that we've now got in this space. And there's more of a comprehensive planning that's happening going forward around family violence and sexual violence. And there's indication now that the funding contracts are going to be like 3 years plus, is my understanding. And so the funding terrain is really changing. And I think something that a lot of people that I talked to were speaking to was the enhanced relationships with government that were really helpful. There were also people kind of voicing, like, we learned that working with government's kind of useless because they move too slow. But the funding piece and the increased trust and availability was great. And like kind of things that surprising little details, like people saying that, you know, folks from government weren't in their seats of power. They were at home with their kids and whatever else was going on. And so people were a lot more accessible. So a lot of trust got built, a lot of relationships got built. And that, I think that bodes really well. People also kind of spoke to, like at Maori Women's Refuge and some of the other folks, they were saying, you know, that they have a lot of trust for Jacinda Ardern and sort of the higher levels of government, but it's the bureaucrats in the middle that they felt had stopped up getting actually what they needed. And so there was a lot of bypassing of that in the COVID context, and people just kind of getting, you know, more flexible funding. And hopefully that's a model that really sticks, I think, especially because agencies are doing more than they have to be accountable for where those funds go. But it seems to be going really well. And something that Rachel Smith at Shine said to me in our conversation that I thought was really powerful and important is that the system has to show that it's stronger than the abuser. And I think in some ways we did that here, and in some ways, you know, with the lack of communication from the higher levels of government in those daily briefs, there were some missed opportunities for that. But there is a real strengthening of our sector that's happening through all of this, and questions being raised about how best to reach and support people in different positions across the country.
Interesting. Some of the things you're observing in violence and partner violence, I've seen in mental health space during this time in terms of pushing innovation or models that, anyway, I've seen similar patterns. So I think it's one of those things where crisis kind of forces people to get out of their own way and maybe be more open to things that we should have been open to, you know, before. So this is a related question to one that Peg started answering, which is Shayna asked, she's working with Palestinian women citizens of Israel, and she wanted you to speak to the dual challenges of being women and a national minority, and how to address intimate partner violence in your context. So I don't know, Peg, if you want, you sort of talked about that with communities of color, but
Right.
if there's anything more you wanted to say, or.
Right. Well, I mean, that services, so yes, very much the kinds of practices that we've been talking about are enable survivors to get help when they may be reluctant to engage with mainstream systems. And I would imagine certainly that would be true for Palestinian women in Israel. Having those kinds of resources coming from the community and making sure that there are advocates within those communities who can effectively connect to survivors before they need to go to shelter is going to be a huge step towards, mitigating the crisis, whatever crisis they might be facing, and helping put solutions in place so that they don't have to access criminal justice systems or housing systems or health systems. So that would be the first thing I would sort of promote.
Goody, you have anything you want to about?
Yeah, I mean, I just echo everything Peg said, but I think the other thing that we've really seen in the UK is that we now have this weekly sector call, which we never had before, between all partners in the violence against women and girls space. And obviously this is being recorded, but in terms of the inclusivity of that, it's just so much it's so much more enhanced because everyone can jump on a Zoom call. Look, we've got like 119 people here just listening to this. So people that, in terms of like proximity and geography and getting everyone into one room, that as a result of COVID-19 has enabled us to do that much more easily. You can just log in and have a conversation. And it's meant that those organisations that have less funding because of our structural inequality and race and all of that, they've got more of a seat at the table, but that's not to say we've still got that totally right. There's still so much more to do in this space. And I think one of my biggest findings from my fellowship was in terms of sort of the intersections of oppression and, what that looks like, and exactly what Peg said in terms of, communities dealing with this in very rural areas, just the way that they know how. And actually now we need to be led more by survivors, and I think that is happening more and more in the UK. So I would just say in terms of like individual work, but also just the sector itself working more collegiately and collaboratively together, and it being more inclusive.
Yeah, Lily, do you have anything you want to add to that?
Yeah, so the New Zealand context is interesting. Historically, we have the Treaty of Waitangi, which is a treaty which supposedly, it's supposed to grant sovereignty to Māori here. And so a lot of the gender-based violence organizations structure their organizations to honor the treaty. And so they will often try to have the like a Māori branch and then a Tauiwi branch, which is a word for the people of the treaty. And so it's an interesting model to work within. And I'm just getting a bit of a taste for it as I've transitioned out of academia and more into these different nonprofit spaces and relationships. And so so here, like, there's a real emphasis on Māori consultation and trying to get people to the table to inform on the needs of Māori communities. I think there could be a lot more done here in terms of serving some of our migrant communities. We do have Shakti, which is a women's refuge organization that is dedicated to migrant and refugee women. And so, getting different people at the table to try to inform these responses, I think, is mission critical and has been for a really long time, obviously, and then seems to be progressing and advancing now, potentially, although there's always calls for, we need more input. We need to be, really getting a better sense of what some of these perspectives are, and what exactly needs to be, what resources need to be offered.
Thank you. I'm going to pose a question that I get asked a lot. I don't know what to tell. I have a hard time figuring out what to tell people. And that is, what would you tell, in your different contexts, a survivor to do now, other than call a hotline, especially in contexts where we're all in different stages of lockdown. But if you're in a situation where there's more lockdown, are there other things you would tell people to do? Maybe Peg, do you want to start?
Yeah, well, one of the things, I didn't talk about it much in my presentation, but the programs that we've been talking to, recognizing that there are so many survivors who are, under lockdown, who might be living with dangerous people, have really stepped up their ability to communicate with survivors. So they've kept their hotlines open more regularly, that, like 24/7. They don't just screen, residents for potential entry into shelter. They really are using their hotlines as a means for survivors to just get ongoing support and safety planning. And we really, really do promote a lot of safety planning, as I said before, that is comprehensive of how to deal with COVID, because we know that a lot of survivors have also been experiencing coercion as their abusers are using COVID as a means to control them in their situations. So programs have really stepped up their outreach to survivors who are in their homes in potentially dangerous situations, just to try and get them some support and break that isolation. And so they've also been using social media to Facebook and Instagram and all of the new different electronic means that can be used to maintain contact with people in a way that is safe as well. That leads to its own set of issues sometimes. It can be like all electronic communications can also be monitored and controlled, but yeah, so I would say go ahead and call a hotline, start developing a safety plan for, with survivors to help them think through how to deal with being in a dangerous situation, how you're going to deal with, when you might want to try and leave, where you're going to go, how to get together all of your valuables, papers, money, etc., so that you are in a position to leave in an emergency if you have to. That would be what I would say.
Thank you, Peg. Goody, do you have anything you want to add, or you feel like that?
Yeah, I think Peg answered a lot of it, but I also think there's been some real innovation that I've seen in England in terms of how we're raising awareness in places where people are accessing support. So in pharmacies, we've got one of our biggest pharmacies, like I said, doing a huge national campaign that it's a safe space that you can go and disclose in. Same in supermarkets. I already mentioned sort of Tesco's, you would have your equivalent, and I think that's really brought around it's like someone mentioned the role of the employers, reaching out. So just knowing there's different access points, it doesn't have to be a hotline, because that might not be the safest place. But I also think there's something in terms of our preparation for the surge. We need to understand that there'll be a lot of people that just will not reach out at this point. So as a sector, we need to be preparing for that surge in reporting. And then really interestingly, in terms of marginalised people that have disabilities or are older generation, they will be isolating for longer than the general population, or shielding potentially. It depends on your country's obviously response to this, but we're going to be dealing with two separate surges, and it's remembering that things aren't also happening at the same time. And when someone said that to me, I was like, wow, yeah, I mean, if someone hadn't said that to me, I don't necessarily think I would have thought about it. So it's just all of those things.
Lily, anything to add on that? Or?
Yeah, so I think a lot of great bases have been covered in terms of the survivor support, but I want to broaden the scope out for a second, because this is such a major problem and it takes all of us doing different things. And we have to hold our governments accountable for the system, because it's not our communities that are failing, it's the systems that are failing. And so some things that people might consider as organizations and even members of the public reaching out to government, whether that's to lobby or get a petition going that demands more government engagement or funding into some of these areas, is a potential step forward. If you're a concerned family member or a friend, there's, reaching out and making sure people know you're there is important, but also to assume that somebody living in a violent situation is living under surveillance, and that nothing that you communicate with them is private unless you are certain that it's private, which is hard to do. So I think those sorts of things are important to keep in mind. survivors are the experts, as we've talked a lot about, like it's survivor led. So survivors are very much the experts of dealing with the situations and strategizing the situations that they're familiar with, that they have to deal with. And so following that lead's important, and affirming their agency and autonomy as an outsider is important. So not stepping in to say, I'm going to rescue you and we're going to do things this way is important. And the last thing I'll say is like something I've thought quite a lot about, which is scope for trying to say engage Airbnb with a group like the Caravan Studios Safe Shelter Collaborative, which Peg turned me on to try to get long-term housing solutions available, because to my mind, motels aren't going to cut it over the long haul. Here in New Zealand, we're lucky. We're not in lockdown anymore, but you know, we may return to it, and a lot of places are going to be in lockdown for a long time. So trying to find those longer term solutions that get people into really truly habitable spaces that are safe from violence is going to be really important. And it may take government engagement and subsidization to see that actually happen, but I think it's worth continuing to pursue and advocate for.
Well, thank you all. I can't believe it. It's noon Boston time, and we have so many more questions that people wanted to ask. We could have probably done this for another several hours. So I think we'll have to have another session on this. And it's one of these things that if it weren't for COVID, we couldn't have pulled this together so quickly, because it would have taken us probably like a year to get our schedules all merged together. So I did want to mention that someone posted that the American Public Health Association's annual meeting is focused on violence, and there might be it's virtual, and there might be the opportunity for late-breaking abstracts. So just to the audience, it would be something to look at. And really, thank you all so much for your insights. This will be posted online, the recording and the slides. And in 2 weeks, our next mental health forum will be on what to expect when you're not expecting COVID. So it's on COVID and pregnancy, and these details will be distributed soon. So thank you all so much, and take care, everyone. Thank you. Bye.
Thank you.
Thank you. Bye.